I'm gonna go through my experience and what I got to do. I'm really grateful that I had nurses that were very excited to teach me and to have me learn. The other days for clinicals, we were doing virtual simulation, which I really wanted to be in the PICU. I mean, it was interesting, but it was also really traumatic. If you know exactly what you want to do right out of nursing school, then go for it. The blood sugars get really, really high and it gets really dangerous and it can be life-threatening for them. I got my flashback right away. Hi guys, welcome to my channel, or welcome back to my channel. My name is Bailey if you're new and you don't know me. I am going to do a nursing video for you guys today. I just finished my pediatric rotation this semester, and so I got through all of my pediatric clinicals, and let me just say, I'm in love. I absolutely loved my time in the hospital for pediatric. I have definitely decided that that is one of my major interests when going into nursing now. Like, if you guys saw in my other nursing videos, I've talked about how this semester was really important because we have our peds rotation, and I will be able to see if I can work with the sick kids, if I can handle it, because peds has always been something that I've been interested in. But I did it and I loved it, and it's been such an amazing feeling to know that my nursing career is a little more set in stone, you know, like I know what I want to go into. We still have labor and delivery to do as well, which is another thing that I'm interested in, so that is also a possibility still. And I'm in my psych rotation right now, which I am actually kind of liking, and so we'll see. We just started, so we'll see how that goes. And I don't know, I've always loved the brain and like mental health and stuff like that, but I never really saw myself as going into behavioral health as a nurse. But you never know, maybe I could do pediatric behavioral health. That's always a possibility, so we'll see. But anyways, I just thought I would go over my experience for you guys, just kind of go over what I did, what I got to see for you guys, if you guys are interested in what a pediatric clinical would look like for you, or if you didn't get clinical for pediatric semester because of everything going on or whatever. I'm gonna go through my experience and what I got to do. So because of COVID and everything, we only got 2 in-person clinical days, and I was on the night shift, but the hospital had a policy that we couldn't bring our phones in. I didn't get really any footage in the hospital, so it wasn't enough to make its own video, so that's why I'm sitting down and talking to you guys and telling you what I saw, what I got to do. The other days for clinicals, we were doing virtual simulation, which if you are in nursing school and you've been in nursing school through everything that's been going on last year and now this year, you know, probably you know of virtual simulations, vSims, and you know that they are not fun. They are so much just like busy work that really is honestly a waste of time. They are so horrible. But we had to do vSims for our other 3 clinical days that we weren't in-person clinicals. And my group unfortunately got placed in the night shift clinical, which, well, I thought was unfortunate in the beginning when I first found out. But as I started to let it like sink in, being like, okay, I'm gonna do the night shift, I realized that it's actually not that bad, because it's a lot more lax. I'll probably learn a lot more, have a lot more opportunity to talk to the nurses that I'm following around, and I honestly was able to learn a lot. And plus, as a new grad, you're pretty much guaranteed to have to go on to night shift, to start on night shift for at least a year, unless you're lucky. So all in all, it was a good experience to see how I would be working in less than a year, because I'll be doing night shift and hopefully I'll get into a peds rotation, or a peds new grad program, whatever they're called, karma. So yeah, for my first in-person night shift clinical, I really didn't do that much because, as you guys may know, last semester we didn't get any clinicals, so I have no experience with any of like the very important meat and potatoes of nursing skills, like IVs, med passes, injections, stuff like that. So I was really nervous to like do any of that, and our clinical instructor understood, the nurses we were following understood, so they basically just let us observe. They knew we were feeling uncomfortable with doing it, and since it was our first rotation in pediatrics, like obviously I'm not gonna try my first IV on an actual person, on a child, you know? So my first one, I didn't do that much, but I got to see a lot. I got to assist in helping another nurse put in an IV in a toddler. I got to work with a baby with a possible CF, cystic fibrosis diagnosis, which was really interesting to research and like see like in person how it would affect an infant. He was 8 months old and he was also born premature, so it was interesting to see all of the difficulties and complications that can come along from a premature birth. So that was really interesting. I got to do a piggyback medication. If you guys know what that is, that's where you attach a antibiotic or something to a pump that's already infusing IV fluids like normal saline or D5 or something like that. And then you have to hang I talked about this in my nursing skills video, but it's basically it infuses the medication and then continues to infuse the fluid once the medication is infused. So I did get to do that, which was very nice to have more practice with that rather than just being in the skills lab. I got to help prep medication. I got to see a lot of medication administrations. I got to do a lot of assessments, listen to a lot of kids' lung sounds, abdominal sounds, bowel sounds, and I think that's about it. I got to talk to the nurses a lot. For both of my clinical experiences, I got to talk to the nurses a lot, and they were really, really helpful and really, really great with students, which I got really lucky because another one of my friends who's also in my group, she was placed in the peds ER, our first rotation, and I got placed in the PICU. So she actually had a horrible experience her first night. The nurses were ignoring her. No one was talking to her. She literally had a horrible night, and our shift is from 6 p.m. to 4:30 a.m. I should have actually said that way earlier, but that was our night shift. So she literally just sat there the entire time and like didn't get to see anything, didn't get to do anything. She had a really crappy first experience. So I'm really grateful that I had nurses that were very excited to teach me and to have me learn and were completely understanding of the situation that we've been in with nursing school recently. But I got to talk to them, and a lot of them were new grads, which was amazing for me because they basically feel like they just graduated nursing school, like they were just where I was. They had already been working as a nurse for over a year, but they still considered themselves new grads, and they were like, I just feel like I was right where you were. So it was really nice to talk to them and get their perspective on like what I should do after nursing school, if I should go into med surg for a year and then specialize in peds, or if I should go right into peds. And everyone I talked to said they went right into peds and there was no point in wasting, because it's not really wasting, like you're still working as a nurse doing something interesting. Like I'm gonna enjoy working as a nurse, whatever I'm doing, but if I have a passion for pediatrics, I'm not going to absolutely 100% be in love with what I'm doing, you know? And that was kind of their argument, was if you know exactly what you want to do right out of nursing school, then go for it, because you are not going to enjoy being somewhere else. And that's what they did, and they love it. They said all the instructors in nursing school tell you to do med surg for at least a year. They were like, that's exactly what we were told as well, but we knew what we wanted. We went right into it, and we are not regretting it whatsoever. So that was really great to hear too, because kind of upset that I had limited peds clinical experience for this semester, and then if I didn't get placed in a pediatric preceptorship for next semester, that means no pediatric experience next semester, and then having to go into med surg for like a year after I graduate. Still exciting, still important, but not exactly what I want to do in my heart, you know? So it is really, really amazing to know that if I can get into a pediatric new grad program at a hospital, that I should do it and I should go for it. So that is what I want to do. And that was my first experience for pediatric clinical, and then I went 2 weeks later for my last night shift in the peds PICU, and I didn't get to be placed in the ER again. I went back to the PICU, which I'm really grateful for, because I didn't want my friend's situation, which wasn't solely what was happening in the pediatric ER, because I had other people in my group who had amazing experiences in the ER and got to see and do so much, but also with the ER, it's a hit or miss. So like sometimes it might be flow flooded with cases and you get to see a whole bunch, which is what happened to one of my group members. She got to see almost everything we had just been learning about and was on our next exam. Like, that was amazing. But then there's other people who got to see maybe two like semi-interesting things and then nothing else. So I don't want to risk it, and I don't have an interest in working in the pediatric ER, so I really wanted to be in the PICU. So that is where I was for my second rotation. I actually had to split it with another group member. So we had two interesting cases that my clinical instructor was trying to split us between. So one was a almost but not yet DKA patient. So this boy was admitted from his endocrinologist because his blood sugars were really, really high and his A1C was really, really bad, really high. And that's basically, if you guys don't know what an A1C is, oh, well, I should tell you what everything is. DKA is diabetic ketoacidosis, and it happens a lot in kids when they either are unable to control their blood sugars or they don't know they're diabetic. So they're eating a lot of sugar, they're not producing enough insulin or any insulin at all to break down and absorb that sugar. So their blood sugars get really, really high, and it gets really dangerous, and it can be life-threatening for them if their parents don't bring them into the ER or recognize the symptoms and call 911 or whatever. So this boy, his A1C, which is the measurement of your blood sugar over a long period of time, like 3 months, and how like well it's being managed, was really, really high, which is really, really bad. So he got admitted. My instructor didn't have all the information on him, so she thought it was a little more critical than it was, but he had been living with higher blood sugars for a while, and he really wasn't as critical and as interesting of a patient as we thought he was going to be. But it was between him and a patient with this condition that makes him get a lot of pneumothoraxes, so collapsed lungs, and then he has to get chest tubes all the time. So this patient had a chest tube in, and I thought that sounded so interesting. I had never seen a chest tube. So I was like, I want that one. Our instructor made us pick between 1 and 10, and whoever got closest was where she was gonna put us. So I ended up picking a number that put me closer to the possible potential DKA patient, and my other group member got the chest tube patient, which I was upset about because I was really excited to see the chest tube. And also the nurse that she was going to follow for the chest tube patient also had a patient that had just been graduated from the NICU to the PICU, and the mom was there. She was post C-section and it was a newborn baby, and I just thought that would be another interesting case to be working with all night, but sadly I did not get that. But either way, the night worked out amazing for me. I was disappointed, but it turned out that it actually was for my benefit. So with the diabetic patient, I got to administer a ton of insulin. I got to prep the insulin. I got to see the whole process of going through all the checks that you have to do, including getting your math checked by another nurse, which is something that I haven't really had an experience with. I've just heard about it in lecture. So that was really interesting. So I got to practice a bunch of injections, which was amazing. I got to help administer medication, IV push medication. I got to hang fluids. I got to piggyback more medications. I got to prep a ton of medications. I got to see, I wrote down everything I did on my little clipboard here. This is so handy for clinicals if you guys don't already know about this. And I can do a what's in my clinical bag for you guys. If you want, I can do that on my channel soon because I love watching those videos and getting new ideas on what to like keep in my clinical bag. It's really crucial. You have everything you need. But anyways, back to the video. I got to do finger sticks, so blood sugar checks for that patient as well. I got to help with an admission of a patient, which was really interesting to watch, and watch the doctor come and like consult and like do his assessment on the new patient and everything. I got to work with a ton of IV pumps, so I got to like set them all up and everything, which is really nice to do because they're pretty complicated if you don't know what you're doing. I got to work with a syringe pump, which if you guys haven't done your pediatric rotation yet, you probably don't know what it is because it's really only used in pediatrics and NICU. But it is a syringe that goes into the pump, and that's the medication. And then it gets pumped into the IV that way through the pump, slowly like compressing it. Does It's actually pretty interesting. I'll put up a picture. I got to administer a bunch of pain medicine, IV push pain medicine. I got to do a COVID test. Oh, that was really, I mean, it was interesting, but it was also really traumatic. I got to do a COVID test on this little toddler, the new admission that came in. They, for pediatric patients that are that young, they do 2 nasal swabs, or the nasopharyngeal swabs, because if one test comes back that it was messed up, they can do the other one and they don't have to put the kid through that traumatizing experience again. But it was very traumatizing. So they let me do it. I was super scared because I had never done one before. And I put them into his nose. He starts freaking out, screaming. They didn't realize how strong he was going to be. They were all holding him down, which sounds so horrible, but it's in pediatric nursing. You have to, it's not restraining, we're not like tying them up, but you have to hold them down. Like, you, otherwise how are you going to get an IV into a toddler, you know? Like, it's hard, but it's for their benefit. So they didn't know how strong he was going to be, so he like ripped free, flung my hand away, so then they had to hold him down and I had to do it again, and he was like screaming and crying, and it was so sad. It was like traumatizing for me to do to him. That was probably one of the hardest things I had to like do or see, because he was in so much distress. Also, that first night helping with the IV for the toddler, that toddler was screaming and crying too. It's hard, but it's for their benefit, and that is what you keep having to tell yourself, that it's for their good. You're doing it to help them, to make them feel better, even though they don't know that, they don't understand that. You know that, and you understand that. But yeah, I got to do a COVID test, which was really cool. And let's see. Oh, and I got to start an IV, not on a patient, but on the nurse that I was following, which was amazing. I'm so thankful she gave me that opportunity. She got so excited when I said that I had never done an IV. She was like, oh my god, you're gonna practice on me. I've had so many new grads practice on me. And she was just so great, and they were talking me through the whole process, and I got it right away. And I was so impressed with myself because I was so nervous to do it, because besides doing it on my dad when I first practiced last semester, and he has like really bulging, easy veins, I had not done an IV on a person at all. And so I did one on her, and I got it literally right away. I got my flashback right away. I was so proud of myself. I did it. I made a huge bloody mess when trying to connect the saline on there to flush it, but they just, and I was like so embarrassed. I was like, oh my god, I feel so bad, I'm making you bleed so much. And they were like, no. A bleeding IV is a good IV, or yeah, a bleeding stick is a good stick. That means you're right exactly where you're supposed to be. Or like, that's what we tell all of our patients. If it bleeds a lot, it's a good IV. So I was like, okay, but I was so proud of myself for getting that. I mean, it was only one, so still have a long way to go before I feel 100% comfortable, but that one went really well, and I was really excited about it. But anyways, this video has moving on for way too long, way longer than I was planning on it to go on for. So I'm sorry guys about all the rambling, but anyways, thank you guys for watching. I hope you guys enjoyed this little sit down chit chat with me about my clinical experience. I can do the same thing for psych. We're now in full clinicals for the next 2 rotations, because everything is starting to get better at the hospital, so they're allowing more students to be there. So I will have a lot more clinical experiences to talk to you guys about. If that is something that you would like to see from me, let me know in the comments down below, and like and subscribe as well. You know what to do, and I will see you guys in my next video. Bye guys.